Good day, everyone. In this video, I will be discussing two major topics. The first one is about nursing assessment involving musculoskeletal system, and the other one is the different diagnostic procedures still involving the musculoskeletal system. Since our area is in orthopedic ward, so definitely our main focus is the musculoskeletal. So let's begin our discussion with the nursing assessment. And alam naman natin when we get the assessment from our patient, and nursing assessment, by the way, is the first of the nursing process na ginagawa natin. Di ba? We have ADPI, you have the assessment, diagnosis, planning, intervention, and evaluation. And definitely assessment precedes the other types of the nursing process. So ito yung laging nauuna. And in doing our nursing assessment, we have, parang it's like divided into two major parts. You have your health history taking, wherein we get the subjective data from our patient. And the other one is the physical examination or physical assessment, where we get the objective data from our patient or with our patient. Okay, so we will begin with the subjective data. Okay, so dito we interview the patient, we ask several questions relating to his or her condition or problem. So, important health information. So, the most common symptoms of musculoskeletal impairment na nararanasan ng mga pasyente natin includes pain, weakness, deformity, limitation of movement, stiffness, and joint crepitation or yung crackling sound na tinatawag. So, you have to take note of this kasi commonly, kapag nagpunta sila patient in the clinic or in the hospital or in any setting, ito yung kanilang common na chief complaint or dinadahilan. Okay? Ito yung common na symptoms na nararamdaman nila. Now, again, in getting the subjective data, di ba, we have different aspects or different questions na tinatanong sa pasyente relating to his or her problem or condition. So first is the past health history. So in this area, we ask the patient about the past medical problems that affecting musculoskeletal. And this includes tuberculosis, poliomyelitis, diabetes mellitus, parathyroid problems, hemophilia, rickets, soft tissue infection, and neurovascular disabilities. So, tinatanong natin kung nagkaroon na siya ng mga diseases or sakit na to in the past because this relates to the musculoskeletal system. Okay? Yung mga problems na to um, are are associated with our musculoskeletal. Next, you have trauma or accident. So we are asking the patient if nagkaroon siya in the past ng trauma or accidents, which definitely will affect or definitely had an affectation sa kanyang musculoskeletal. Then we ask question like symptoms of arthritic and connective tissue diseases. And an example of that is gout or systematic lupus erythematosus or SLE. Symptoms of osteomalacia, osteomyelitis, and fungal infection of bones or joints. And then we ask possible sources of secondary bacterial infection. So, for example, ear infection, tonsils, teeth, sinuses, lungs, or genitourinary, because these infections can enter the bones, resulting in osteomyelitis or joint destruction. So these are the things that we ask the patient kung na-experience sila in the past. Next, we ask the patient about the medication. So we ask prescription and over-the-counter drugs and herbal products and nutritional supplements. So with detailed information about each treatment, name, the dose and frequency, length of time it was taken, and then its effects. Diba? Tinatanong naman talaga natin in our health history taking sa ating, I mean, in our history taking or health, what's that, in our um, health history taking sa ating pasyente, yun nga, itong mga, kung meron siya mga gamot na iniinom ngayon or ininom in the past, either nireseta man yan or over the counter niya na binibili tapos iniinom niya or tinitake niya. Okay? So, the use of skeletal muscle relaxants, opioids, NSAIDs, and systemic and topical corticosteroids, ayan, we ask the patient if he or she is using or taking this because it affects or it has to a certain degree affects our musculoskeletal. So as we go along to our topic with the different diseases, so ma-encounter or ma-discuss natin specifically itong different drugs that affects the musculoskeletal. So let's continue. So still, when it comes to medications, so the drugs that can have detrimental effects on this system in your musculoskeletal includes anti-seizure drugs, which may cause osteomalacia, phenothiazines, it affects gait disorder or it um, produces or it may affect your your ability to walk properly. Pwede kang magkaroon ng gait disturbances, corticosteroids, so such as a vascular corticosteroids can cause a vascular necrosis, decrease bone and muscle mass, and then potassium depleting diuretics, it can cause naman muscle cramps and weakness. And then for women, we ask them about their menstrual history because 'di ba, we know na kapag menopause na si woman, 'di ba, it places her at risk of developing osteoporosis because of the changes in advancing age. And that is menopause. That is because of the menopause. So nawawala yung estrogen, which is very important in their bones or in our bones in general. Then inquire about calcium and vitamin D supplements for both women and men. So we ask them kung nagte-take sila ng calcium and vitamin D. Okay? So next is the next after medication, we ask about surgery and other treatments. So information about past hospitalizations related to a musculoskeletal problem, tinatanong natin yan. So we ask them about the reason kung bakit sila na-hospitalized, the date and duration, the treatment, and then the rehabilitation. And then you obtain specific information regarding any surgical procedure, post-operative course, and complications. Next, we after asking those things, we may proceed with the functional health patterns. Ito naman yung susunod na aspect na gusto nating i-focus in getting the subjective data from our patient. At ito ay inorganize ni Gordon, and commonly, di ba, we call this as the functional health patterns. So the use of functional health patterns assist in organizing the assessment data. And yung una is, first on the list sa ating functional health patterns, we have the health perception, health management pattern. So in this area, we ask about maintenance of a normal body weight, avoidance of excessive stress on muscles and joints, and use of proper body mechanics and the use of proper body mechanics. So we ask the patient if ginagawa niya itong mga bagay na ito. Okay? Kasi makakatulong yung mga ito to prevent disorders or problems with our bones. So dapat we apply proper body mechanics when lifting objects and then nag-exercise to maintain our desired or normal body weight among others, okay? And then we ask specifically about tetanus and polio immunizations, okay? Because tetanus and poliomyelitis affects the musculoskeletal system. So for example, in this image, we can see here the typical contractures of polio. So, kung ikaw ay hindi ka, wala kang vaccine ng polio nung tayo ay bata, so mahirap or probably will be at risk of having polio. Pero um, lahat naman halos ng bata here in the Philippines, 'di ba? Binabakunahan na ng ating ng polio. Okay, binibigyan na ng polio vaccine. Okay, and then ito lang just to show you, ito yung mga contractures ng mga taong or ng mga ng mga pasyenteng may polio. So, kita kita natin yung deformities sa kanilang bones. And then for tetanus naman, okay, kapag sila ay na-infect ng bacteria na to, so it can cause, ayan, stiff muscles all over the body. So, that's the reason why we ask the patient if na bigyan na sila ng vaccine or immunization ng tetanus and polio. And then obtain the most current date and reaction to a tuberculin skin test. Okay, so tinatanong natin kung tuberculin skin test na siya so that we can identify kung siya ay nag-negative or nag-positive ba if ever sa test na ito. So in this case, 'di ba, nag-inject tayo ng tuberculin. It's a fluid na parang inactive protein of TB. Okay, and then ini-inject natin siya sa intradermal or sa skin ng ating pasyente, and then after some time, 'di ba, we measure for any allergic reactions. So kapag ka less than 5 millimeters yung ating injuration, it is a negative result. Okay? So, ayun, that is for the tuberculin skin test. So, dapat we take note if nagpa-ganito na si patient before or hindi pa. Okay, next we have, so to continue, sa health perception pa rin tayo and health management pattern. So, we ask the safety practices of the patient sa bahay, home life, recreation, and exercise, which can affect the patient's predisposition for certain injuries and illnesses. For example, kapag siya ay nasa bahay lang or work from home, di ba, na predispose siya na laging nakaupo. So, to adapt into that kind of situation, so we can use this one, okay? One way to use a chair to beat a sedentary lifestyle. Okay? O kaya you maintain a good proper or a proper posture when you use your computer or kapag ka prolong yung iyong pagharap sa iyong laptop. Okay? So ergonomic adaptation. And then family history. So we ask the patient kung um, meron sa pamilya nila na nagkaroon ng, for example, rheumatoid arthritis, systematic lupus erythematosus, ankylosing spondylitis, osteoarthritis, gout, osteoporosis, and scoliosis. Kasi ito ay may mga genetic predisposition. Okay, so if meron ka sa iyong pamilya or nasa lahi, so it predisposes you to have the same disease. Okay, so genetic risk alert tayo. For example, yung mga autoimmune diseases. So many autoimmune diseases of the musculoskeletal system have genetic basis involving human leukocyte antigens. So ito yung mga autoimmune diseases na to, examples are ankylosing spondylitis, rheumatoid arthritis, and SLE. Okay, so yan nga, namamana yung mga sakit na yan. Another is osteoporosis. So genetic factors, malaking role din yan para ikaw ay makapag-develop ng osteoporosis later in life. And then the other one, we have osteoarthritis, then you have gout and scoliosis. So if one of your family members ay nagkaroon yan, so it also predisposes you. And then muscular dystrophy. So it is a X-linked recessive disorder naman. Okay, so the next one is a nutritional metabolic pattern. So this is another area in the functional health patterns of Gordon, so nutritional metabolic pattern. So dito, it's a description of a typical day's diet. So tinatanong lang natin sa ating pasyente or kliyente, ano yung mga kinakain niya daily. So an adequate intake of vitamin C and D, tapos calcium and protein is essential for a healthy, intact musculoskeletal system. So yun yung mga, these are just some of the gusto nating malaman if when it comes to the client's diet. And then maintenance of normal weight is an important nutritional goal. So obesity places additional stress on weight-bearing joints such as the knees, hips, and the spine. So ayan, kaya kadalasan yung mga pag makaka-encounter tayo ng mga obese, talagang yung super heavy ng kanilang weight, it places additional stress dito sa kanilang mga weight-bearing joints like the knees, you have the hips, and then sa kanilang spine. Okay? And then, next is elimination pattern. So ask the patient if an assistive device such as an elevated toilet seat or a grab bar is necessary to accomplish toileting. So, gumagamit ba sila niyan if they are toileting or not? And then decreased mobility secondary to musculoskeletal problem can lead to constipation. So kung hindi gumagalaw masyado si patient, so definitely it predisposes him or her to develop constipation. So musculoskeletal problems can contribute to bowel or bladder incontinence when ambulation is a problem. Next is the activity exercise pattern naman. So we obtain a detailed account of the type, duration, and frequency of exercise or recreational activities. So sinisiyasat natin itong mga recreational or exercises na ginagawa ni patient. Okay? Sporadic exercise can be more problematic than regular exercise. Yung mga sporadic exercise, yung mga paminsan-minsan lang yan depending on the season. Kaya halimbawa, tuwing summer, ayun, medyo dahil summer, maraming madalas siyang nasa labas, nakakapag-exercise siya. Pero come rainy days, ayan, matagal na hindi siya nakakapag-exercise because of probably the weather. So that is an example of sporadic exercise. So yung regular, definitely, ito yung like 3 times a week. So this is much better. Okay? So yun yung gusto nating malaman when it comes to activity exercise pattern. Now, extremes of activity related to occupation. We wanted to know a sedentary occupation. It can negatively affect muscle flexibility and strength. Okay? So jobs that require extreme effort naman through heavy lifting or pushing can lead to damage of joints and supporting structures. So gusto nating malaman yung kanyang trabaho. Okay? Kung lagi ba siya nakaupo or baka naman extreme effort yung nire-require ng kanyang trabaho that involves, for example, heavy lifting or pushing. So this affects your musculoskeletal system. Next is the sleep-rest pattern. So we ask about possible alterations in sleep problems. So if the patient describes sleep interference related to a musculoskeletal problem, you have to inquire further about the type of bedding and pillows used, bedtime routine, sleeping partner, and sleeping positions. And then we have the cognitive perceptual pattern. So we explore and document any pain experienced by the patient as a result of musculoskeletal problems. So di ba nga ito yung isa sa pinakamadalas na symptoms na nararamdaman ng mga may problema sa musculoskeletal system. It is the pain. Okay? So as a baseline data, you have to ask the patient to describe the intensity of the pain on a numeric scale from 0 to 10. So this is like yung kanyang illustration. So 0, no pain, 1 to 3, mild, and then 4 to 6, 4 is moderate, going to 6 is severe, 7 to 9, you have very severe, and the worst pain is 10. Okay, the possible worst pain, and that is 10. Okay, so yun, tinatanong natin sa pasyente, pinapa-rate natin kung gaano ka-severe yung kanyang nararanasan when it comes to pain. Ask about measures used for managing pain. So, ano naman yung ginagawa niya para mawala or somehow ma-alleviate yung pain. So, you ask about related problems such as joint swelling or muscle weakness. Now, when we say paresthesia, this is a burning, tingling sensation or numbness na pwedeng maranasan ni pasyente. So it is caused by pressure on nerves or by circulatory impairment. So yun yung tinatawag nating paresthesia. Tingling, burning, or numbness sensation. Okay, next we have self-perception, self-concept pattern. So chronic musculoskeletal problems can lead to deformities and a reduction in activities that can have a serious negative impact on the patient's body image and sense of personal growth. So baka, ayan, this is a good nursing diagnosis, di ba? Which is a risk nursing diagnosis if wala pang deformity na nangyayari sa pasyente. Okay? So risk for ineffective or risk for altered body image kapag ka meron tayong musculoskeletal problems. Risk pa lang kung hindi pa nangyayari ha, risk nursing diagnosis. Pero pag nandiyan na, then altered body image na. Okay, so ayun, we have to solve or somehow matugunan yung problem na to in terms of self-perception or self-concept pattern. So assess the patient's feelings about these changes, okay, because of the musculoskeletal problems. Okay, next we have role relationship pattern. So we have impaired mobility and chronic pain from musculoskeletal problems can negatively affect the patient's ability to perform in roles of the spouse, parent, ability to perform roles of spouse, parents, or employee. Diba? If you are in chronic pain or hindi ka makagalaw, you really cannot perform your role as a parent, for example, or as a father, or as a mother, because definitely hirap ka nga, 'di ba? Hindi because of the musculoskeletal problem that you have. So that's one of the problems kapag ka may altered tayong or may disorder tayo in this system. So you have to ask about role performance and relationships. Kasi baka nagkakaroon ng stress when it comes to the relationship dahil nga hindi niya matugunan yung kanyang role. Okay? Next, determine the degree of assistance available from family, friends, and other caregivers. So you have to find out if additional resources are needed, such as physical therapy and home health care. So you have to ask then kung meron ba siyang support group or support person kung if ever na mag-isa lang siya sa bahay. Okay, baka distant yung kanyang family members or yung parents. So you have to ask. And then sexuality, reproductive patterns. So the pain of musculoskeletal problems can impede the patient's ability to obtain sexual satisfaction. So that could be a problem in terms of the sexuality or reproductive pattern of the patient. Okay, so you have to explore this area with a sensitive and non-judgmental attitude. So this is a sensitive topic, so you have to be careful in talking about this to your patient. And then help the patient feel comfortable discussing any sexual problems related to pain, movement, and positioning. So if you establish a good rapport sa iyong pasyente, probably pwede siya mag-open sa iyo. Okay, pero hindi naman natin pinipilit yung ating pasyente when we ask questions. So kung ano lang yung gusto niyang i-share, yun lang yung pwede nating mahingi or makuha sa kanya. Okay, pero again, we always tell our patient na we need as much as information na kailangan natin so that we can really identify his or her problem. Okay, next, coping stress. Coping and then stress tolerance pattern tayo. So we ask the patient about cultural or religious beliefs that might influence the patient's acceptance of treatment for the musculoskeletal problem. So baka it can be a hindrance or baka hindi pala accepted sa culture nila or sa religious belief nila yung, for example, yung treatment na ibibigay natin or yung treatment na available. So you have to know first kung itong kanyang cultural and religious background. Okay, and then we have the value belief pattern. So mobility limitations and pain are serious potential stressors that challenge the patient's coping resources. So recognize the potential for ineffective coping. So as a nurse, we are critical thinkers, so dapat nakikita natin yung different aspects na to. And then in this slide, I just placed here yung mga different questions na pwede nating itanong sa different parts of the functional health patterns ni Gordon. Okay, so here, please be guided na lang and kindly read this slide na lang for more details. Okay, so let's proceed to the. So after the subjective data, after the interview, after asking questions, so we will now proceed subjective data. So again, we get the objective data or obtain the objective data through physical examination. And please do remember the different techniques in performing your physical exam. Diba? You have the IPPA, the inspection, palpation, percussion, and auscultation. Okay, so first inspection tayo. So a systematic inspection starting at the head and neck and proceeding to the upper extremities, lower extremities, and trunk. So that's how we inspect the patient systematically. So inspect the skin for general color, scars, or other overt signs of previous injury or surgery. And then note the patient's general body build, muscle configuration, and symmetry of joints. So when we talk about symmetry, compare natin yung two body parts for any differences and similarities. Observe for any swelling, deformity, nodules or masses, and discrepancies in limb length or muscle size. So use the patient's opposite body part for comparison. So yun nga yung sinabi ko about the symmetry. And then this is just the inspection. We use our eyes, our senses to to get this details or this information. So we just inspect. And then this is an example of a deformity na na-experience sa mga may RA. So kitang-kita yung deviation, di ba? Ayan, ito yung sinasabing symmetry ng dalawa. Okay, ng both hands. So we compare for any similarities or differences. Okay, next we have the palpation. So after we inspect, we can now palpate. So for palpation, carefully palpate any area that has aroused concern because of a subjective complaint or that appears abnormal on inspection. So kapag sinabi ni pasyente, if ever kanina sa health history taking na may problem siya dito or in this part, so you can palpate. Or during your inspection, nakita mong may abnormal mass, so you can palpate as well. Okay? So palpation usually proceeds cephalopedally, meaning from head to toe, to examine the neck, shoulders, elbows, etc. So remember na in palpation, you have to warm your hands to prevent muscle spasm. So um, we we make sure na warm yung hands natin before we palpate the body part of the patient. Palpate both muscles and joints to allow for evaluation of skin temperature, local tenderness, swelling, and crepitation. So when we say crepitation or crepitus, this is the grating, crackling sound or sensation as the irregular joint surfaces move across one another. So kapag yung dalawang joints ay ginalaw or pinamove natin yung joint. So kung sila ay irregular joints, so we can probably hear this sound, yung crepitus na to. So this is a crackling sound, a grating sound, or a sensation. Independently. Okay, so pag passive ROM naman, it occurs when someone else moves the patient's joints. So measurements should be similar for both active and passive maneuvers. So when you say active range of motion, it means patient takes his or her own joints through all movements without assistance. Ibig sabihin si patient, yung nag-move ng kanyang joints independently. While si passive ROM naman, it's otherwise. Meaning, tinulungan mo si patient or si client to move his or her joints para ma-perform yung full range of motion. So that's the difference between active and passive. So kita nyo rito si active, the patient moves independently, and then si passive, ayan, tinutulungan siya ni nurse or ng healthcare professional. Okay, next we have, so to continue about motion, so be careful performing passive ROM because of the risk of injury, especially kung mga medyo maedad yung ipa-passive ROM natin since tayo yung magagalaw ng joints nila or ng body parts nila. So you have to be careful. So if pain or resistance is encountered, stop the manipulation immediately. So pag hanabi niya masakit na, so you have to stop na. If you note deficits in active or passive ROM, also assess functional ROM. So pag sinabing functional ROM, this is used to determine if performance of activities of daily living has been affected. So this is done by asking the patient if activities such as eating and bathing need to be performed with assistance or cannot be done at all. Ibig sabihin, kung nagagawa niya pa yung mga task niya, okay, yung mga activities of daily living. So it's like the functional ROM. Okay, next you have the range of motion is most accurately assessed with goniometer. So, goniometer measures the angle of the joint. So again, mini-measure natin yung ROM with the use of this goniometer. yung angle ng joint yung tinitignan dyan. So, specific degrees of ROM of all joints are usually not measured unless a musculoskeletal problem has been identified. So, i-measure mo lang siya if may nakita ka na problem in the system. Okay? If may na-notice ka. So, a less exact but valuable assessment method is to compare the range of motion of one extremity with that on the opposite side. So, kino-compare natin yung um, opposite side or yung the other part. So, this is the goniometer. So, this is how we measure the joint range of motion using this instrument. Okay, so naka-angle siya. Okay, so dito I just included the synovial joint movements. So you have encountered this already in your health assessment subject. So you have the different movements and we have here the description. So kindly read na lang. And then muscle strength testing. So in this case, grade the strength of individual muscles or groups of muscles during contraction. So ayan, parang nire-resist ni patient yung force na ini-exert mo. Okay? Using his strength. So, grade normal muscle strength as a 5 bilaterally. So, kapag ka with full resistance to opposition. So, 5 yung binibigay natin. Bilateral, ibig sabihin both parts. Ibig sabihin both hands or yung kanyang feet. Okay? So, that's bilateral. So, have the patient apply resistance to the force the examiner is exerting. So, that is muscle strength testing. So, ito yung pag-grade ng ating muscle strength. So, this is the scale. 0 is no detection of muscular contraction. So, ibig sabihin, walang strength at all. 1, barely detectable. 2, active movement of body part with elimination of gravity. 3, achievement against gravity only and not against resistance. 4, active movement against gravity and some resistance. And then 5, full yung resistance without evident fatigue. Ibig sabihin, normal strength yung 5, normal muscle strength. Okay, next, measurement tayo. So when length discrepancies or subjective problems are noted, so you have to obtain the limb length and circumferential muscle mass measurements. So for example, you measure the leg length when gait disorders are observed. So nakita mo may problem siya with his or her gait. So you measure the leg length. So measure the affected limb, just like this, between the anterosuperior iliac crest and the bottom of the medial malleolus and compare with a similar measurement of the opposite extremity. So, measure muscle mass naman circumferentially at the largest area of the muscle mass. When recording measurements, document the exact location at which the measurements were obtained. For example, the quadriceps or the quadriceps muscle is measured 15 centimeters above the patella. So, you have there the exact location. Next, this pertains to the patient's use of assistive device such as a walker or a cane. So you have to ask if gumagamit siya niyan. If the patient is able to move independently, assess posture and gait by watching the patient walk, stand, and sit. We have the posture. So tinitignan din natin yung posture ni patient. The normal curvature of the spine is convex through the thoracic position, through the thoracic portion, and then concave naman through the cervical and lumbar portions. So, I'll show you the picture later, So, ito yung mga deformities of the spine. So, we have kyphosis. It is the increased forward curvature of the thoracic spine. Commonly seen siya sa mga older patients with osteoporosis. Lordosis or sway back. So it is an exaggerated curvature of the lumbar spine, frequently seen during pregnancy naman, si lordosis. Scoliosis, lateral S-shaped curving deviation of the spine. makikita nyo unequal yung kanyang shoulder and scapula height, and usually noted when the patient is observed from the back. So, pwedeng congenital siya, idiopathic, ibig sabihin hindi identifiable yung cause. Or it can be the result of damage to the paraspinal muscles as in poliomyelitis. Okay, so ito yung tatlong deformities involving the spine. Again, kyphosis, ito yung increased forward curvature of the thoracic spine, lordosis, way back. And then scoliosis, S shape. So, tingnan natin, ito yung picture. So, ito yung kyphosis. So, andito yung problem. Okay, so again, pag sinabing kyphosis, di ba? Increased forward curvature of the thoracic spine. So, naka-forward itong thoracic area natin. And then for lordosis, ang problem naman dito is exaggerated curvature yung kanyang lumbar spine. So, ito yung lumbar area. So, exaggerated yung pagka-curve. And then for the scoliosis, so the problem here is curving deviation of the spine. So, naka-lateral siya. Lateral yung deviation. So, parang naka-S. Okay? So, kita natin na hindi pantay yung scapula and the shoulder. So, ito yung ating normal spine. So, ang sabi rito, di ba, we have convex yung thoracic portion. So, convex yung ating thoracic. So, naka-convex siya. Ito yung thoracic. And then, concave na itong cervical and the lumbar. So, this is the normal spine. So, ito yung another picture of the scoliosis in standing erect posture. So, ayan, hindi pantay yung kanyang scapula and the shoulder. So, S-shape siya. And then, gait naman. So, after the posture, we ask the client to walk para makita natin yung kanyang gait. So, observe a gait for smoothness and rhythm and any unsteadiness or irregular movements. Frequently noted sa mga older patients, yung mga unsteadiness na yan or irregularities. So, considered normal yon sa mga matatanda. Okay? Yung mga unsteadiness or irregularity. So, variety of neurological conditions are associated with abnormal gait, such as spastic or hemiparesis gait. So, this is, ito yung ating spastic gait. So, kapag na-stroke sa pasyente, so, ganyan yung nagiging gait niya afterwards, depending on the stroke, definitely. Steppage gait, ito naman yung steppage gait. So, parang hindi niya fully maangat yung kanyang toes. So, parang nakadikit lagi siya sa floor yung kanyang toes. And then you have your shuffling gait. This is for the Parkinson's disease. So, ayan, may mga tremors yan. Tapos, yung kanyang posture is parang naka-forward din. So, ito yung these are the different types of gait. So, marami pang iba. Pero, ito lang yung, for now, as of the moment, yung for the musculoskeletal. Okay, next we have, okay, so, effusion examination. So, this is done if joint motion is compromised or the joint is painful. So, again, effusion exam, ginagawa lang siya if there is a problem in joint motion or pagramdam ni pasyente na masakit yung kanyang joints. So, pag sinabing effusion, this is an excessive fluid within the capsule, swelling and increased temperature that may reflect active inflammation. So, di ba we have discussed about joint, and then alam natin na about the cartilage, okay, and then you know about the synovial fluid. So, ito yung tinitingnan natin for the effusion examination. Okay? So, here, so increased temperature that may reflect active inflammation suspected if joint is swollen. So if a small amount of fluid is present in the joint spaces beneath the patella, it may be identified by the following maneuver. So again, kung napansin na ni examiner or ni nurse, for example, yung na may parang problem with the joint spaces beneath the patella, so you already know where your patella is, di ba? So you can perform this maneuver. So meron tayong the ballotment test and the balloon the ballotment sign, and you have the bulge sign. Okay, so please, I have here the link for wherein where you can watch the how to perform the test and how to identify if positive or negative siya sa bulge sign or balloon sign at saka sa ballotment sign kung positive siya or negative sa ballotment test. Okay? So, please, I have here the link and I will send this PowerPoint sa inyo so you can go directly to the link. And then the other one, we have the straight leg raising test. It is performed on the supine patient with sciatica or leg pain. So kapag may leg pain or sciatica pain si patient, we do this straight leg raising test. So just like this. So we passively, meaning tayo yung nag-aangat ng raise of the patient's patient's leg 60 degrees or less. So the test is positive if the patient complains of pain along the distribution of the sciatic nerve. So minsan, 60 degrees pa lang or 40 degrees pa lang may pain nang nararamdaman sa patient habang nire-raise natin yung kanyang leg. Tapos straight dapat yan. Okay, so a positive test indicates nerve root irritation from intervertebral disc prolapse and herniation. So, again, so 60 degrees or less yung pag-raise natin sa leg ni patient. Next, we have neurovascular status. So, perform frequent neurovascular assessments of patients with musculoskeletal disorders, especially of those with fractures because of the risk of tissue and nerve damage. So, madalas natin ginagawa to kapag may problem sa patient. For example, fracture nga. So, we assess most of the time or frequently for neurovascular status. So, when we say assessment of the neurovascular status, we refer to an assessment of the color, warmth, movement, sensation, and pulses were palpable. Kung anong mang body part yun. So these are the indicators of peripheral neurovascular dysfunction. Ibig sabihin, ito yung mga indicators na may problema tayo sa neurovascular ni pasyente. For example, in circulation, if the color is pale or cyanotic, if the temperature is cool, capillary refill is more than 3 seconds, so you have to be wary na. Okay, you have to be alerted na kapag ganito yung situation. And then, motion, for example, there's weakness or paralysis. And then sensation, if there's paresthesia, unrelenting pain, pain on passive stretch, and absence of feeling. So, maging tawag dito, you have to be wary na or maging concerned ka na kapag ito yung mga nakita mo sa patient mo. Okay, so ito yung mga normal physical assessments of the musculoskeletal system. Ito yung mga pwede nating i-document. Normal spinal curvatures, no muscle atrophy or asymmetry, no joint swelling, deformity, or crepitation, no tenderness and palpation of spine, joints, or muscles, full range of motion of all joints without pain or laxity, and muscle strength of 5. So these are all normal assessment. And then I included here the different assessment abnormalities. Ito yung mga findings, ito yung description, ito yung mga possible causes. So please read na lang. So for example, ang finding is a contracture. So what is a contracture? Resistance of movement of muscle or joint as a result of fibrosis of supporting soft tissues. So I will leave this up to you. So can you read na lang these assessment abnormalities. So this is in line with the musculoskeletal system. So that is the first major topic of this discussion. The next part is about the diagnostic studies or diagnostic procedures of the musculoskeletal system. So first we have the X-ray or bone X-ray. It is also known, we have here the rentgenogram. That would mean the X-ray photograph. So again, rentgenogram is an X-ray photograph and is the most common diagnostic study used to assess musculoskeletal problems and to monitor the effectiveness of treatment. Simply, we call that as X-ray. Okay, specifically, this is bone X-ray. So, ito talaga yung common na ginagamit in the hospital to identify, for example, any bone problem or bone fracture. So because bones are denser than other tissues, so X-rays do not penetrate them. So dense areas show as white on the standard X-ray. So X-rays provide information about bone deformity, joint congruity, bone density, and calcification in soft tissue. So ito yung mga naibibigay na information ni X-ray. So fracture diagnosis and management are the primary indications for X-rays. So yun yung importance ni X-ray. So this is an example of the photograph. Okay, so this is the X-ray itself. So this is the left hand. Next, we have arthroscopy. So it is a small fiber optic tube called, pag sinabing arthroscopy, this is a procedure. Okay? So, ito ay gumagamit ng small fiber optic tube called an arthroscope, which is used to directly examine the interior of a joint cavity. So, the procedure is known as arthroscopy. So, after anesthesia has been administered, a large bore needle is inserted into the joint and the joint is distended with fluid or air. So, nilalagyan natin ng fluid or air yung joint na yun kapag nakapag-insert na tayo ng large needle. So, when the arthroscope is inserted, the surgeon is able to perform extensive, accurate visualization of the joint cavity. So, nakikita na ni physician yung nasa loob ng joint. So photographs or videotapes can be made through the scope and a biopsy of the synovium or cartilage can be obtained. So, yun yung importance ni arthroscopy. So this is, ito yung like the screen na nakikita ni physician yung nasa loob ng joint. And then, ayan, ito yung arthroscopic instrument, and then the cannula. So, naka-anesthesia naman si patient yan. So, nursing interventions mo during arthroscopy. So, ito, after the procedure, the joint is wrapped with a compression dressing to control swelling. And then ice may be applied to control edema. And then joint is kept extended and elevated to reduce swelling naman. And then the nurse monitors and documents again the neurovascular status. Analgesic agents are administered as needed. The patient is instructed to avoid strenuous activity of the joint. And then the patient and family are instructed to monitor for signs and symptoms of complications like fever, excessive bleeding, swelling, numbness, and cold skin. So after arthroscopy, the next procedure is arthrosynthesis. So ito naman, it is joint aspiration and is usually performed for synovial fluid analysis. So it may also be done to remove fluid from joints to relieve pain. So first, the skin is cleansed and a local anesthetic is given. After an 18 gauge or larger needle is inserted into the joint and the fluid is withdrawn. So kailangan nakaabang na yung ating sterile container to receive the aspirated fluid and then must be transported appropriately in the laboratory. So patients with inflammatory joint conditions such as RA, septic, and osteoarthritis may be treated with intra-articular injection of corticosteroids after the joint fluid has been aspirated. So pwede na mag-inject ng steroid um, kapag pag ito yung mga problems, RA, OA, septic arthritis. So this is the procedure. Ito yung arthrosynthesis. Okay, so this is where we aspirate the excess fluid. So si physician naman yung gumagawa niyan. So ina-assist lang natin. And then the fluid is examined grossly for volume, color, clarity, viscosity, and mucin clot formations. So ang normal na synovial fluid is transparent and colorless or straw-colored. It should be scant in amount and of low viscosity. Now, yung fluid na nanggaling sa infected joint may be purulent and thick or gray and thin. So, ibig sabihin infected talaga. Gout, sa gout naman, the fluid may be whitish yellow. So, blood may be aspirated if there is hemarthrosis due to injury or a bleeding. So that's arthrosynthesis. So what is your nursing intervention? So hair may need to be removed from the site before the procedure if depending on the protocol, and then pain may be a concern. So analgesic may be given if that is the case. Ice may be prescribed for the first 24 to 48 hours post-procedure, and antibiotics are prescribed post-procedure then. So the patient and family are educated again for possible signs and symptoms of complications. Ngayon, I listed here all the diagnostic studies involving musculoskeletal system. So again, kindly read thoroughly na lang. So we have here, for example, the X-ray. Ano yung description and purpose at ano yung nursing responsibility mo. So naka-highlight dito yung most common. So CT scan, MRI, and then we have dual energy X-ray absorptiometry or DEXA kung tawagin. This is madalas din to no, to assess or to diagnose for osteoporosis. Tandaan, DXA or dual energy X-ray absorptiometry. This is commonly done sa mga pasyenteng sinususpect to have osteoporosis. Ito yung under endoscopy, yung arthroscopy. Okay, and then, ayan, mineral metabolism, you have alkaline, you have calcium, then you have phosphorus. And then for the serologic studies, you have the RF factor or rheumatoid factor, ESR, ANA or anti-nuclear antibody, uric acid, ayan. And then for another, we have creative protein, HLA, markers of muscle injury, CK or creatinine kinase, potassium, and aldolase. Invasive procedure, arthrosynthesis, at yung discuss natin kanina, EMG. So that is also invasive. And then yung mga miscellaneous or other diagnostic procedures. So that comprises my discussion. So thank you very much for listening and God bless.